Thank you for all being here as well. It's been a fantastic afternoon, and thanks to our wonderful speakers and the chance to, in fact, sort of giving us further insights into the wonderful talks we experienced today. I, particularly thank our speakers, Professor Fellows, in terms of, following your patients together, learning in terms of natural history and understanding the disease processes. And Dr. Johnson, in terms of a lot of insights and kind of really changing the myth, in terms of sexuality in the older patient population. And, patients who I see and actually, sort of answer questions and try to advise them as well. Yeah, so really very, very realistic. And despite my anxiety, I took some big breaths, and so following Professor Northoff's suggestions and understanding, better in terms of the connection between rhythm, the heart, as well as the brain in terms of anxiety. Thank you so much, for those insights.
Yeah, thanks for that question, and I think it's. I think it is a very important question with a lot of different implications related to public health and policy, as well as to individuals. That nobody likes to think about bad things, and HIV was it seized us. It was terrible when there was no treatment for it. It hasn't gone away. It's just that we have many more tools to deal with it. And the tendency to kind of say, oh, well, it's sort of handled now. I mean, nobody wants to have to take a pill every day for the rest of their life to stay alive. But it's true that without the direct experience of close friends or people dying from a terrible disease, it's easy to sort of let things slip away in terms of focus on prevention, focus on early detection and treatment, and we see that in individuals whose behavior is, that we can sort of track the tendency of people to follow public health guidelines as opposed to reduce their personal risk, and that has kind of drifted away as the direct experience that was traumatic in the 80s and early 90s is no longer kind of, as you say, not so much in living memory, but in the memory of the cohorts of people and the age groups of people where risky behaviors are especially likely, perhaps, not to undercut. My colleague here is going to tell me that risky behavior is happening at every age. But the other thing that I think is worth thinking about is that in the world we have the tools to reduce and eventually eliminate HIV. Even though we don't have a cure for it, we have the tools to prevent transmission, but it requires 100% of people with HIV to be 100% on the medications. And the world was moving towards that and is still moving towards that, and then abruptly it stopped moving quite as strongly that way with changes in the US AID program and so on. And rapidly, political decisions have really changed the landscape of public health around HIV. So it's not only individual considerations, but even thinking about the impact of this in the world and our collective responsibility to use the tools we have. And HIV is one example, but you don't have to be that. You can think of many other examples. For example, the vaccine-preventable infectious diseases of childhood, like measles, we eradicated it in Canada, and now it's back because people didn't know people who had children who had died from measles anymore because we eradicated it. And so there was less pressure to vaccinate, and now unfortunately, we're going to have people who know people whose children were very sick or died from it, which absolutely unnecessary. So human beings, we're talking about the amazing brain. That's not so amazing, our brain. We forget quickly, and we look at numbers and statistics as one thing and personal lived experience as another. And I think your point is very important that because you don't know somebody who has it, that's just a statistic. We really do need to keep thinking about those statistics as real people, and to learn from those things, to take the steps we can take as a society to to protect our health, our collective health. We have the tools and we don't always use them.
There's almost a sense of taking your umbrella off in the rain. Thank you.
Yeah.
I think that's a very relevant question. This is the challenge for chronic disease quite often. And so, even the example of COVID, and that we deal with patients with long COVID, and now, it's a battle to get patients, considering vaccines, right? But I do think that it's a potential important partnership, in terms of understanding the science behind it, having the patient, sort of a community, and also, sort of our storytelling. I think the storytelling is so important. Our media and other partners can actually make a difference in terms of sharing the educational experience.
I think it's early days for us to understand one of the things that really there's two things that interest me about the observations from studies in the general population aging, and that we see as well in our HIV population is it just the same? Is it just the same thing? It certainly could be, and that's not uninteresting. Or is it somehow magnified or interacting so that the combination perhaps of having chronic issues with, low-grade inflammation or side effects of the drugs you're taking, and on top of it, whatever the factors, the actual mechanisms by which the social isolation or social stressors are actually affecting the brain. So I'm very interested in the mechanism, which I don't think we know much about. The one that we're pursuing now has to do with what we do know a lot about, of how chronic stress affects the brain. And that perhaps the social experience of being stigmatized and isolated, it's in part related or activates the HPA axis and creates a chronic stress situation. And if so, that could actually relate, for example, interact with the cardiovascular risk, because we know that chronic stress is one of the cardiovascular risk factors, depending on where you're studying it, and how is that going on in the body. So I think the possibility of understanding the mechanisms are really interesting, because they're giving you direction. They're giving us new directions to think about the brain. And I would say one of the areas where neuroscience is actually missed opportunities, let's put it that way. And I think today's talks really highlight the fact that people are kind of waking up to the fact that the brain is in the body. And also that we, as people, using our brains, interact with each other. And those are both really important kind of situational aspects of that relate to how the brain works and how it maintains health and how it can become dysfunctional. So I think it's very exciting because it's opening all kinds of new directions to understand the brain that we need. There's a lot we need to understand still. Thank you.
And also you offer new opportunities for treatment as well.
Yeah. Direct social intervention to protect the brain. Like that's.
Absolutely. Yeah. And certainly, one of the things that I actually find in these longevity cohorts, right? So one is they are active, good diet, but one of the magic factors is actually social intervention.
So put your Sudoku down and go out and talk to people.
Absolutely. This is what we'll do after this session.
Yeah, thank you for the question, and very good question. And you hit the hot spot here with me, because the brain is for me about time. It's about time scales. Time scales are different durations. Imagine time scales are like, here are no windows. If you have different window sizes, you see through the different window sizes the same tree in a different way. Sometimes a small window gives you a zoom in into the leaves. A big window size makes it a whole tree, and then maybe the city in the background. And that's exactly the way you have to imagine the brain, like different window sizes for its time scales. Yeah. And so now you say, how is that related to the sense of self? So basically you encounter the environment through these different windows, temporal windows in your brain. Yeah. And if these window, and that's basically yourself, is sitting at the other end and looks through all these different windows. Now if these windows themselves, now imagine these windows become irregular. Sometimes it changes, one becomes a little larger, the other one becomes a little smaller. You're confused. And that's exactly probably what happens. So imagine, let's say you're on a team session or Zoom session, and it's cracking. Sometimes you're earlier and the other one is later, and that changes all the time. You become insecure, it gets on your nerve, and let's say now imagine it's really an existential situation. You become anxious. So that's exactly what happens. And what you see here, what I'm trying to do with this dynamics, as we say, pattern or irregularity, that's the basic disturbance of anxiety. You can measure that in the brain, but you can measure that irregularity also in your thoughts. And that's what we're developing diagnostic tests. And the anxiety is essentially a self-disturbance. Yeah? Your self is too irregular. There's no continuity. You cannot recognize your own self, and you become uncertain. You cannot make decisions. So your self becomes literally too irregular. And that's what we measure on the neuronal levels as well as psychological level. So for me, then I conclude, mental disorders are basic self-disturbances, but different temporal aspects. For instance, psychosis, schizophrenia, there's probably temporal imprecision in the millisecond range. Yeah? Again, I get back to the team session. The other one comes a little too late or too early. You're confused. That's what happens probably in the brain of schizophrenia. Whereas in depression, the brain is usually too slow. So when I had my comparison with a ship, the brain is the ship, the stormy waters is the environment, your brain is the ship, and the ship is the self. That's literally true.
So maybe I can just follow up on that observation there. And certainly, patients, for example, when they're anxious, their heart rate will increase. They can get irregular heart rhythms. And in fact, there's been studies to show that these cardiac arrhythmias actually aggravate the anxiety sensation. So there's actually that vicious cycle. Now, for the heart, we can actually find ways to calm it down or reset the heart rhythm. And so from the brain aspect, if you're anxious, I think you mentioned that the breathing can help potentially, resynchronize that. Are there other ways to do this, in terms of calming things down,
For instance, we're doing the music. So different people, we're playing rhythmic music. And if the drugs, what I would expect from future drugs, and that's what we're trying to test in our computer models, that the drugs specifically address the rhythmic nature of your activity. That's the kind of drug you want. Yeah? But music, we have very good effect also with the music, rhythmic music, personalized in these patients. And also the heart. And that's very important. These timing things, that's your subjective experience. Yeah? And you come, at least to the psychiatrist, not maybe also to the cardiologist, because of the subjective experience of your irregularity. Yeah? It gives you uncertainty. That's why you come to me. You do not come because of the irregularity. You become to me because the irregularity, how you experience and the meaning. That's important. And for that is this temporal envelope or dynamics or the time scales important.
So that's interesting. Recently, I was in San Francisco, and I took the trouble of downloading the Waymo app. I don't know how many people have tried Waymo. Yeah, so it's actually a driverless ride service, right? I want to test it out. It's Google. And so you get in there, and there's no driver there. And but the first thing is that they will talk to you, and then later on they'll actually play music. So maybe that's the way to actually calm you down while you're in that driverless
Peter, you can always call me.
Thank you.
Oh, sorry. I was also just going to. I'll just add to Dr. Northoff's points. I mean, it's true. I mean, absolutely. In terms of deep breathing, I think it's so fundamental to anxiety regulation. You also made the point about anxiety being a disorder of the self, and so I think part of that, in addition to deep breathing and music, which no doubt can be effective, you made a point in your talk, and perhaps a conversation we'll have at the reception after. But there are dozens of meta-analyses that show that cognitive behavioral therapy is actually quite effective in the treatment of anxiety, and particularly various anxiety conditions. We talk about generalized anxiety, social anxiety, panic disorder, PTSD. So there is an aspect here where you are focusing, yes, absolutely, on deep breathing. It is a critical tool. I think any therapist would be myopic if they didn't use deep breathing as part of their toolkit. But in addition to that, I think also narrative reframing can also be very powerful. So just to add to that, that therapy can actually be quite effective.
Yeah, okay. Practical tip there, fantastic.
Good questions. The first question, in age, I did not directly test it, but it is known that in age, your brain becomes less variable. Yeah, that's very well documented, meaning you're less flexible. Yeah, that's for sure, that has been well documented. Whether you're prone to anxiety, I know it as a clinical psychiatrist. I worked for many years in geriatrics. Indeed, when you have less cognitive control, you're more prone to anxiety. And that probably goes along with higher irregularity, higher entropy. In concussion, I observed exactly the same. I don't see Dr. Zemek anymore. I had many for evaluation of concussion patients. Indeed, anxiety and what he described earlier goes exactly along with probably high irregularity and the entropy. And I emphasize the irregularity / the entropy for two reasons. First, I think this is really what people experience. So for me, the starting point for any mental disorder assessment is the subjective experience. We developed systematic scales for that. And then from the subjective experience and its temporal features, I can infer to the time of the brain, the dynamics of the brain. So that goes back and forth. That's why I emphasize so much the dynamics of the brain and the time of the brain. And I think in concussion, this is indeed, the time is extremely short, they're extremely fast oriented. And if you're fast, you have a high likelihood to become irregular. Yeah, some people enjoy the fast. Yeah, they can't have it fast enough, no problem. Some others don't. There you see how personalized it is.
Right, okay. So it shows the personalization aspect as well. Maybe I can also pose a question for Dr. Johnson. And being a cardiologist, we prescribe actually a lot of medications. And to maintain the cardiac health. And but unfortunately, a lot of side effects of those medications affect sexual function. So I sometimes will get try to understand the side effect of the medication. Try to find the combination that will be helpful. But it is variable in terms of the patient's comfort in talking about this. And unfortunately, cardiologist appointments are kind of relatively short. And what is the best approach in this type of setting, in which we are trying to kind of at least optimize or minimize the side effects? And but yet, these are somewhat complicated conversations, with the patient. Are there ways in which we can approach the subject, that is positive and understanding rather than kind of very, very perfunctory, and offer some practical advice and things like that, and so that this is something that is not feared by the patient, because the patients are quite often anxious about it. They don't feel comfortable talking about it, yet it can be actually a barrier, in terms of taking the medications. Yeah.
That's a really good question, Dr. Liu. I think, certainly as a psychologist, when I'm doing an assessment for anyone who's coming to therapy because, let's say, they're experiencing low desire, I didn't mention in the talk today, but typically an assessment has to be super thorough, where we're looking at a number of factors, where it's not only about, let's say, how the person thinks about their condition or their relational factors that can affect it. We also do ask about medications that they're on and what health conditions that they have. It really is a biopsychosocial model. We have to focus on the biology as well as the psychology and the social aspects of what bring people into therapy. And so when people often tell us about medications, I'm not a medical doctor, I'm a psychologist, but it does require some rudimentary understanding of which medications are more likely to cause those side effects. And so having a conversation with their health provider is what we recommend. But certainly for the person in your shoes, I think, we live in such a culture where we're so afraid to talk about sex and how it can affect the body, or rather how medications can affect the body. But I think it's just worth it to just let people know these are the side effects of the medications, this is the way it could potentially affect you. And I think just to be frank about it, right? I don't think I don't think it's doing anyone favors to, let's say, be very sly about the topic. I think we need to have upfront conversations. Now, certainly, I think we can also invite, there is a model in sex therapy that's also been applied to healthcare. It's called the PLISSIT model, PLISSIT, for those of you who want to look it up. I can't remember what the entire acronym means, but the P in PLISSIT is about permission. We ask the patient for their permission. Can I talk to you about what to expect from a sexual standpoint with these medications? And I think sometimes you can ask for their permission and then have that dialogue.
That's wonderful. Yeah, great advice. Maybe we could wrap up the session, and I was going to ask our speakers to kind of give that one actionable advice, for everybody in the room. Maybe you can start out with Professor Fellows.
Well, to protect your brain health and your cognition, and for healthy aging, if you smoke, quit smoking.
All right, you heard it. Dr. Johnson.
I would say that, since my topic was specific with older adults, but across the lifespan, I would want to speak about the term resilience, that yes, the brain is a supercomputer, but not without its glitches. At the same time, we are still very much capable of learning throughout the lifespan, and I think especially for older adulthood, you mentioned wisdom. I think that's certainly an important part of what helps us. But to think about resilience in terms of that learning continues throughout the lifespan, that even neuroplasticity continues across the lifespan. Yes, it slows down, but the ability to form new pathways, to strengthen existing ones, and to keep learning, that continues to extend across the lifespan. So I'd focus on resilience and continuing to learn.
Yeah, fantastic advice. Yeah. Dr. Northoff?
Yeah, time links brain and mind. The neural waves of your brain are directly in your mind waves, for instance, in your thought, in the fluctuations of your emotions, and that may go abnormally wrong in mental disorders. And I hope that we can provide a more proper diagnostic and also precision therapy of that in the future, as in other disciplines like cardiology, like oncology, which are really role models for me.
Yeah, and also participate in Dr. Northoff's special app. And talking about time, I think time is up. And so just like to wrap up the session, and I'd like to thank the audience for a fantastic session, for our speakers, really providing excellent insight into the latest research, but at the same time communicate, in a way in which, everybody can actually understand and take away important points, for our own lives as well. And so this is really a special opportunity. And of course, this relates to an organ that we all, sort of treasure and share, and that's the brain. And this is a great opportunity in this particular session to also explore the brain and the heart connection. And so this is a particularly important event because it really bridges the gap in terms of the scientific understanding, the challenges we face in our society, in our patients, in the public, but actually, bringing forward with the real world solutions and stories that can actually impact on all of our lives. And as the co-director for the Brain-Heart Interconnectome, this is a particularly privilege for us, to be here working together with the Brain Canada, and this is a fantastic partnership in which we can actually bring programs like this. But we would like to continue this opportunity in the future, maybe also bring the session to Ottawa, and that we can actually, bring to a larger audience, but while sharing the opportunities here in Montreal as well. And so we know that the disease and the disorders affecting the brain and the heart are really interconnected. We heard some really wonderful examples of that, but the solutions, in fact, between the systems are also ready, and so that we can actually benefit both organs at the same time. And this can make sure that we can have people live healthier lives, happier lives, and building resilience, as we heard earlier. And so we really actually would like to continue this type of opportunity. And but we heard earlier, in order to really improve our brain function and also, having a healthier heart, there's nothing like a little bit of exercise and a little bit of social connection. So in order for us to actually have the reception, I'd like to invite you to climb up these set of stairs and then go over to the other side. So it turns out that the reception is actually just behind this auditorium here, and to come down on the other side of the stairs, where you can actually see a number of posters as well, which are the work profiled by a number of investigators who are actually here in Montreal. Some of them are funded by Brain Canada, so you can actually get a chance to actually speak with those who are actually doing the work. They'll have a name tag, and so by all means connect with them and learn in terms of the additional innovations there. But the speakers will be there, and we get a chance to actually interact with each other. So that's also the social interaction that we'll all seek as well. So I'd like to particularly also thank the staff and the team at the Brain Canada and also Brain Heart Interconnectome for bringing this session together. Thank our speakers, and thank you for joining us for this special occasion, and we all learn together, and so your comments and feedback will be so important for us to actually move forward together, both from the science and for the lives together. Thank you so much.